I definitely do think that everything we do has like a community partner. I've never been part of a project or part of a program or participated in anything where it wasn't community clinical linkages. It wasn't partnerships. So that's why, truthfully, I'm always amazed over, like, I've been in my career for almost like just about 10 years, and constantly it's grant after application. And I think it's, like it spans more than 10, 20 years where there's always a section that calls for like community partnerships. And it's so weird to me that that has to be spelled out because and maybe it's because of the limited resources that we have, but what we'll always have is another human, another person in another space.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Halina Palacios. Halina is Chief Operating Officer for Population Health at Commonwealth Healthcare Corporation in Saipan, Northern Mariana Islands. She's also currently an American Hospital Association Next Generation Leaders Fellow. Halina is a proud daughter and innovative leader of the Commonwealth of Northern Mariana Islands. She's passionate about strengthening, empowering, and improving the health and health systems of her community. She conferred a bachelor's in sociology and psychology at Portland State University and a master of public health at American Public University. In today's episode, you'll hear and learn more about why it's important to always be a student in your professional journey, how public health serves as a connector and advocate for health initiatives, the value of lived experience in public health, how this simple island girl from Saipan is making a big public health impact, why education can be a crucial investment in one's future and not just college education, and her journey of continuous learning and growth in leadership, and much, much more. Be sure to hit that subscribe button, send this to a friend who gets some value. Merry Christmas, and enjoy today's episode.
This is Halina Palacios. I'm out here just trying to make waves for a healthier tomorrow, and you are listening to Public Health Careers.
Thank you so much for being on the show. Welcome to this show. I'm super excited to learn more about your journey and hear about how your lived experience kind of plays into all of your public health experience. So, to just jump into things, how do you identify, and tell us a little about your personal background?
So I would identify as I try to be a simple island girl, born and raised on the beautiful island of Saipan, which is part of a U.S. territory called the Northern Mariana Islands. Got my undergrad on the mainland, is what we call it, in Portland, Oregon, at Portland State. And right after that, I moved home where I've been serving and being a part of my community since.
What was it like growing up in Saipan?
I would say I don't think that I ever thought life was as simple as maybe it really is until I moved or started, like traveling a little bit here and there with my family, just small trips, and then actually getting into experiences through school to like do summer programs in the mainland and stuff. But I definitely will say that growing up in Saipan, it is just super wholesome. I never realized, I didn't know the terms of introvert, extrovert, all of these things. Growing up in Saipan, you are just constantly surrounded by people, whether they're your family or your friends or just people from school or, in the community. Like it's just one whole community. So you know everybody from your bus driver to the cashier at the mom and pop. And, it's just not that everybody's trying to be in your business, but it's almost like it's almost everything that goes around. Everybody does notice. And sometimes that's an aspect of life that you don't think about when you're in it.
That's real, and thank you for sharing that. I was talking to
Yeah.
someone just recently about like the loneliness epidemic that we're having, and I think a lot of it is due to those lack of community ties and just lack of community that we typically have in our day to day in the mainland. And I think that is interesting. I can imagine the change in pace of life going from there to a place like Oregon, Portland, Oregon.
Yeah.
And is that a typical destination for people from Northern Mariana Islands to go to school, or what
Um,
how's it? Yeah.
yeah, I think, I mean, I can't say because I haven't asked everybody who has gone to school, but both of my parents went for education after high school in Oregon. I really do think that it has a lot to um, distance wise.
Hmm.
I think a lot of people, like around my parents' age and even before that, when they were going off and exploring college, it was like the West Coast is the closest coast to us geographically for the mainland of the United States. So there you'll find a lot of islanders who don't are not from Hawaii who live in Hawaii because I think it's like it's closer in Parks and Bay, but now it just costs a lot to live there. But you'll find a lot of people from the Northern Marianas on the West Coast and then into Idaho. And now it's like, now it's so different. Like we, Google technology and just experience over the years has like really brought in on where you can go to get your education. But that was almost a sense of like there was familiarity. Like my parents kind of still knew where things were. They've been to the school that I was gonna attend. I had family living there, and that I think to them was really important because it was like I wasn't a drive away. And when I started going to undergrad, which will show my age in this podcast, I don't even think Skype was a thing yet. So it's like really just a phone call, right? And doing your best to make sure there's some foundation and I want to say safety for guidance for the best outcome that truthfully I think any parent or any support system tries to give to their kid or their family member when they're going on a venture that they're not all going to be there physically to support.
Yeah, understood, and that makes a lot of sense. Last question before I shift the conversation a little bit. Like, what is your favorite thing about the Northern Mariana Islands?
Um, I mean, it ties back to what I said earlier. I will say, though we live a very simple life, it feels very full. During my undergrad, I lived by myself. I had a lot of friends and family who were there to support me, but um, every time I came home, I felt full in a different sense, and I would
Hmm.
always be people are like, oh, how can you be homesick? Like you're with a lot of your friends that were from back home. I'm like, it's the simple things that I guess made me realize like how much I loved and wanted to live at home. It was like I just missed noise. Like silence is so deafening to me. And like it like I know everybody needs a moment to themselves here and there, but I really do like just walking by people who I know each other, just like walking by people who sometimes like I feel like you can feel it off of somebody when you feel like they're in a state of fear or like they're uncomfortable and just being able to walk out of my office and just know even though there are people who are not feeling at their 100% best, like they find comfort and feel safe in a space, and that means a lot to me. Um, because we really do live in a world that is so different from even 5 years ago, let alone 10
Hmm.
or 20. So that feeling, it's not something that you can really write down on or pinpoint what it is, but it's there, and that's what I enjoy most about being.
Well, thank you for sharing. I hope
Yeah.
that I'm able to visit there sometime near in the future. I'll
Yeah.
definitely keep you updated. But that's amazing, and I'm looking forward to hearing. And I guess like to tie this more into public health, how does that sense of community and that sense of belonging tie into your understanding or the way that you practice public health?
I definitely do think that everything we do has like a community part. I've never been part of a project or part of a program or participated in anything where it wasn't community clinical linkages. It wasn't partnerships. So that's why, truthfully, I'm always amazed over, like, I've been in my career for almost like just about 10 years, and constantly it's grant after grant after application. And I think it's, like it spans more than 10, 20 years where there's always a section that calls for like community partnerships. And it's so weird to me that that has to be spelled out, because and maybe it's because of the limited resources that we have, but what we'll always have is another human, another person in another space. Like, I may not have all the like physical supplies of like medical supplies or this guidance book or that, but what we do have is like people with lived experience. And I think that that's something that is so important in our culture and our health system, and especially in public health. I think there's a lot of mainstream stream things that have changed over the years, but truthfully, what is consistent is the need for community partnerships. So, I don't think taking the approach of community clinical linkages is a new or innovative idea. I think it's just really expanded and to be called that term, right? Maybe 30 years ago, like if you went into the clinic and you needed something that was like not being able to be provided in your doctor's office at that time, there would like be like maybe two or three partners, like, oh, we can call social services or we can call like the bigger hospital or whatever. But now what public health, or actually the whole health spectrum, I think has expanded to is something that like I do admire it. Like not just for the nation, but for the world. It's like, how you now have specialty services like behavioral health services. It's like even services that are targeted to the elderly or just the kids or just the people who are like trying to figure it out. Um, really what health has expanded to, and all of those different avenues, I think is why we continue to hold on in the importance of community clinical linkages, because a lot of times I feel like when you think of like clinical aspects and clinical treatment, it's so standard. It's like A, B, C, D. And if anything, it's just getting upgraded by new medicine and whatever. But, there's always a part that like after you receive that care, like there's the foundation and lifestyle change that's not happening in your doctor's office every day. Your lifestyle change happens at home, whether your home is your own personal home, whether it's somebody's couch or it's somebody's like corner with just a roof over your head. It's like all those aspects where I feel community spaces are more welcomed. And truthfully, um, don't have a price, right? And I think community clinical linkages tries its best, or, it's almost like, I don't want to say safety net. It's just like trying to provide like a solid foundation that actually spans. So you don't feel like you're only solid on your feet for like an X amount of time. Like the goal is for it to continue to go and build and have a whole pathway till, truthfully, you're like at your end of life. Like, so that, that's really why I think it's important, especially in our community, in our health system. Uh, we run a health organization that is, we have the sole hospital, we're semi-autonomous. We have the public health agency and we have the behavioral health agency. And we're all intertwined into one health organization. So within that, it's not it's not an outside thought. It is literally what happens whether you're getting discharged from inpatient in the hospital or you're done with your annual doctor's visit in the clinic. Like these are all things that are rotating and being advocated for. And we don't, nobody has been able to do it perfectly yet, but I will say we are trying our best, and that is something that we continue to strive for and strengthen so that it's not just modeled within our system, but within all our partners.
Well, I appreciate you sharing that.
Yeah.
And and a question that's coming up to my mind is like in the work that you do, I don't know, is health equity something that you'll talk about, and then what does that look like in practice for you all?
Yeah. The term and the conversations around health equity, I really feel, at least in the public health space, I feel like within the past like 5 to 7 years, it is something that has been building. But truthfully, and I did previously say this in another interview, that in the CNMI, and especially in this health system, which I'm not just saying because I work for, but because I'm a community member of, I don't remember it not being a time where health equity was at the forefront. It just wasn't termed that.
Mm.
We provide care for everybody. Yes, truthfully, we know that it takes money to keep doors open and, continue to build on services because the needs of our community are changing, right? The health of our community is changing, but it's never been an option. Like, and I don't know what that stems from, but because it's never been an option to not provide for our community, we keep the wheel churning, and it's like we just have to provide services no matter what. And my boss and like my CFO sometimes tell me like that's how they know I'm not a finance person, because I worry about what else can we do? What, and they're always like, okay, because they know I'm not worried about the finance part, but that's why I trust in them, and I hear them and give space to them when they need to hit, like, give me the guidance and like, okay, this is how we can do it in this approach and at this tempo. Which I am very thankful for, that I work and live in a space that is that. It is difficult, I know, on the back end and on all the intricate workings of health systems, whether it's public or private. But health equity is, yeah, it's just, I just don't think it's termed that where we're from. It's just, um, in our vernacular, it's like hinemlo of our people. It's like the health of our people, and that's really what it's about for us.
And what does public health mean to you?
Public health, when I saw that, I was like really thinking about it, because I think sometimes when you're in your work, especially in public health, like you don't ever really take time to stop and think like, oh, what does public health mean? Or, but truthfully, I feel like it's the um connectors. I don't even know what the name of this is the best way I can explain it. As a connector to like those toys that build structures, right? Like everybody has the straws, but without the connectors, you can't ever build a solid structure, anything that somebody can recognize. Um, because I think public health serves as the advocate, public health serves as the linkage, and truthfully, I feel like public health a lot of times serves as the translator. And it's not even from translating from language to language. It's just literally translating on why something should be important to you, why you should invest in this in your health, or how even to take the first step towards a lifestyle change that a person may or may not need. Um, so that's what I feel like public health is. And it is the 24-hour line. It's not even about a helpline. It's also being, I think public health serves as the main advocate, not just for people, but I think for other agencies and avenues that have grown over the years. Like, whether it's education in the schools, or where health is in the schools, or, education programs getting funding that are now public health programs, whether it's tobacco cessation or breastfeeding boot camps. It's like all of these things that were once ideas. I think public health always has been an initial investor and believer in taking a chance on these initiatives to truthfully expand on what health could be for our people.
And before Halina was this public health expert, you began your journey. You began your journey with bachelor's in sociology and psychology at Portland State University.
I
Tell us
did.
about that thought process going into undergrad.
You might edit this part out of the podcast, but um, really my undergrad journey and what I tell all of my staff, from my interns to my coordinators to my managers and directors, I feel like education is so important. It's really the first test in your life on your commitment to self-investment. That's really what I feel your undergrad is, because there's nobody that's like, you have to take A, B, C, D, like for 12 years. This is the complete guidance tool. Like, this is really the first test of, do you have do you have a style? Do you have a preference? What really is your interest? What sparks your fire? That's why I think a lot of people change majors, because like initially they want to go on something basic, then they take like a conflict resolution class and they're like, oh my God, I love this, I love that. Thankfully that wasn't I don't know if I was too invested down within the first couple of years. Like my mom always tells me, you were in some kind of slow accelerated rate. But I I really do believe that was like my first test to how much I would invest and commit to something that's solely mine, right? I think everybody has a common story of doing this for my parents. Like, this is for our future. This is to make our lives better so that, my kids don't have to have these difficult experiences and so forth, right? I think everybody has that whether or not, no matter where you stand financially, I think everybody has some kind of story that relates to that. It's really the securing of your future and those that come after you. And um, so, you really have to believe in yourself. And that's really hard when you've had somebody that's your parents or your support system, your friends, your other family that have been like pushing you, like, oh, 12 years, like once you get out of high school and even at that, like, or whatever end of like intermediate education you have. But when you go into college, that's like, it is the free world, and just being committed, because I think what that shows on your resume when you then go to apply for a job is like, this person committed to something that truthfully didn't pay them. Like, how far are you willing to wait? There is no instant gratification for going to school, and so
True.
I think that's why people take different paths. And I think education is important, not just for people. I don't think everybody should go to undergrad, but again, that is a testament to how far are you willing to push yourself and to listen when yourself is telling you like, this is not for me, this is not for you, and maybe you do go into a trade school, but that still takes commitment. Like, one of the hardest things I always say is taking a break and being able to return for motivation for a totally different direction or even in the same direction. So that's really what I feel about undergrad and like just get like, education in general. But I have no regrets. I think it definitely, I enjoyed living in the mainland. I got many experiences and got to travel to different states. And also, I will say one of the most beautiful things is that it reassured me that I wanted to come home. I shared earlier that sense of like, I hate being lonely. Uh, and now being where I am, I think when you feel it in your gut, just trust it. Um, coming home has afforded me so many opportunities that I don't know if I would have them or be in this position or be on this podcast if I was still living in Portland or in my apartment by myself. Like I just don't know where I would be, but um, it definitely gave me so much more of an appreciation for where I come from and where my foundation is.
And when you ended undergrad, was it in your mind that there was no doubt that you were going back home?
Yeah, no doubt. Like it was not a question. You know, my parents, we were fortunate enough that they flew out when I graduated, and my dad sat me down and he was like, "Listen, um, do you want to stay? Do you want to keep going to school? Do you want to find a job? Like, we can help support you a little bit more until you get a job or get on your feet." And I was like, "Nope, nope." Let me pack it up. Like, it just, I wanted to be home. I missed a lot of simple things in my life. I think in your 20s and like your late like teens, like you just want to get all these experiences, right? And it's like, then reality sits in and you're like, oh, but is that like something that like I can sustain every like, eventually you really do have to grow up, and is that lifestyle conducive to where you want to be in 10 years? I mean, obviously I wasn't thinking that when I was 21, but
Right.
I was highly motivated by this sounds really funny, but just not being lonely anymore and having noise in my house. Whether it's my mom yelling from the kitchen for something or just like hearing kids outside or just being able to go out and have a conversation with somebody. Um, it's just something that like was really, really important.
And I think you highlighted it as well. Like you wouldn't have realized how important that was for you if you didn't take the time to go away
Yeah.
and even to your point, like invest this time. And I've never heard of it like put this way, but yeah, you're going into school and there's no instant gratification in that. And that's real. That's real. That's
Yeah.
real.
And that's what
Yeah.
I truly feel. Because I'm like, I get it. I get why people, and it's like there's so many people that I've heard their stories and like people that I went to school with. It was like I knew that like my story wasn't the same as many others. There are many others that had to have a full-time job the same time as going to school. And like having a job is a different kind of hustle, but that gives you like some type of instant gratification. And like when you weigh out like what your reality is and needing to earn your finances to keep the roof over your head versus something that's like you don't even know if it's gonna take. Everybody said like 10 years ago it takes 4 years to get, or like 20 years ago it took 4 years to get your undergrad. But they didn't tell you that's like if you're like 4 or 5 credits in every semester or trimester. Like I remember I was like, what is this? Like, do I have to go to school the whole time? But it's that, and like but I think that's a testament to what is challenging in life. I think things that come with instant gratification are just, it's just like so much easier to make those decisions at that moment, and then you're like 5 years in, and you're like, damn, could have made a different decision or a different investment, but then the thing is, or like my outlook on life is like when you get to that point, you can't get stuck on that thought for too long. It's like then you either gotta shift to continue on the path you're on or be ready to like try and make those changes to go in a different direction.
I can agree with that more because being in that space of uncertainty is just it's not a healthy place to be for anyone. It's
Yeah.
like, yeah, yeah. So tell me this: you got your bachelor's in sociology. You're coming out of undergrad. You're saying, "I'm definitely going back home. Thanks for the help that you wanted to give me, parents." So you go back home. You're a public health quality coordinator at the Commonwealth Healthcare Corporation in
Yeah.
Saipan, North Mariana Islands. When did you know about public health before applying for this job? Were they just jobs that you were applying for and you ended up landing in this job? How did all that happen?
Yeah, no. So I came home and like getting a job was like a little bit more difficult than I realized, but I now realize that when they're telling you what the American dream is, or I don't know if it's the American dream or just like any dream to keep kids going to school, but they just say like this is supposed to help you get a land a job. Nobody's landing anything. You still have to. What they don't tell you is that you still have to put in work, and you gotta like then make it your second test to like, is this something that really interests you? And truthfully, when I first moved home, I was applying for jobs in our school system. I wanted to be a counselor, actually. Uh, and then there were some things that didn't work out there. And then um, I had like a little bit of a stint, just I needed a job. I needed to get some money in my pocket. And like, I think just like my first experience at like a job after college. So I did some like work at a private clinic, and that was like started to like spark my interest because I was like, oh, I like talking to people and like serving them, but like I'm not the one that's solving all their problems or like giving them prescriptions to what their problems are. Which I think is the sociology part of my interest. And around that time, like I saw this, um, I got the opportunity to work as a public health quality coordinator. And I didn't have the full understanding of public health was. I thought growing up, public health just meant the health system. It meant the hospital. You know, it meant like who you see to feel better. So I didn't understand like, oh my God, like how big of a spectrum. But I will tell you what I did do. I definitely did Google it, and I was like, oh my God. Like I think it was like my first time I ever saw like the essentials of public health, like how far it spans, and all of that. I was like, that's interesting. And from there, there was like a little bit of a spark. And then when I got into my role for public health quality coordination, I had to work with all the programs. So I literally had to sit down and interview each program and kind of give them, I guess what would be like almost like a podcast interview now of like, what do you do? Like, what does your program do? What do you do for the people? Like, what's your goals? And all of that. And so it gave me a better understanding of like how solid public health is, truthfully, and what part it held in our health system. And like, it was from that I was like, oh, this interests me so much. Like, I love how they get into the community. I love how all of their stories and all their results are tied to people, whether no matter what you look like, no matter if you have $1 in your pocket or you have $100 in your pocket. Like, I love that, and I guess it again, it ties into like, feel like there's so much conversation, and I don't know if that's tied to my not liking to be lonely, but I feel like public health is such an open, vibrant space. And yeah.
No, I appreciate that. And that is definitely, I feel like the questioning that goes into many people's head is like, oh, I don't know what public health is. Then you learn about public health, and then you're like, okay, I kind of understand what it is, but then you're like, oh, now I know that there's so much more in public health, and then it's
Yeah.
just trying to figure out like what you want to do in all of that. And so tell me a little bit more about what you did in this role. And I know that you also shifted or got promoted into a corporate quality performance manager role.
Yeah. So around the time when I started was like in public health was like the space for like quality improvement, performance management, and accreditation. And so that like the public health quality coordinator was like handling. It was like getting people to do reporting that wasn't just for your grantor, being able to like look at metrics, like it was like really starting the performance management button for public health. Because I think, and I don't know if this is, I think it is. I think I've had enough conversations where it's drivers in the mainland. Like you report a lot to your grantor because that's tied to financials, right? But are you invested in like learning? how well you're performing to self improve your program. Um, and truthfully, it was set up in a system where, I explained earlier how like we live in like in a it's not a duplex, it's a triplex, right? It's behavioral health, public health in the hospital. In the hospital, those standards are set, they've been set for years. They're tied to like Medicaid and Medicare, and so they have quantity recordings. So that's something that all the units and programs in that house are used to. So it was just implementing it into public health and having all of the programs, choose some metrics that were really important to them that aligned with things that were of priority to public health. And, like going over those reports and it's not just for the higher ups and it's not just for the managers, but having the staff be able to understand that and, get into the groove of like putting in the numbers and then making changes if needed. And if not, learning how to be consistent in a habit and being able to go say it's okay, we can look into something else that may be of challenge, or even the culture of change. I think that is hard, like in general, and like we use public health quality to be kind of a driver for that. Because creature of habit, right? Creature of comfort. Why am I going to fix something that I don't feel is broken? Or like, how do you know that it's not broken? And also, how then do you go into a space of innovation and changing and being one step ahead for like your health system and your people eventually?
All right. And after this position or during this position, you decided to pursue a master's of public health at the American Public University. So,
Yeah.
how did you get to that point where you're like, okay, I'm going to pursue and invest in myself to get this master's of public health?
Yeah. So, like you mentioned earlier, after like public health quality coordination, I got into the role of like management for quality overall for the health system. So, I was doing honestly, a lot of my work was tied to like hospital things. I still was like getting like keeping my hand in the pot for accreditation and driving performance management and stuff, but um, it wasn't something that I was doing on the daily. So I was also interacting a little bit less with all of these public health programs. Um, but in the hospital side, it is so easy to see the impact that public health and health programs and partners can have on a person's health. So I was like, dude, this is where it's at. Like I need to like be more solid in it. It's really, I think it was at that point where I was like, okay, this is either gonna change direction or we're gonna move forward, but it's like one or the two, and I need to like continue to build and continue to learn so that I can be like the best part of the team that I'm in and the best like manager or the best like, advocate. And so I was like, I really like public health. My boss will probably kill me for saying this, but it's just like I said earlier, like it's so much more vibrant. You get because I feel like in clinical and hospital spaces, what I tell everybody that works for me is like nobody comes into these doors for a birthday party or the circus. Everybody's in some kind of pain. And so I want to be part of the driver that's outside that makes these experiences into our health system. It took a little bit longer, or it's a little bit less painful because we did all this pre work and work after to make sure that, somebody's trying to live their best life, if not a good life at the very least.
And while you were in your master's program, what were some experiences or moments that were like important to the learning and just your journey?
I think, the difference between undergrad and master's is, again, this is now most people are fully working. And so a lot of things that I had to research when I was an undergrad to find the answer and learn from that, were experiences I was already having. So I was just like digging for the support and just feeling a lot more validated in the decisions I was making in my work life and actually in my life too. But that tested my self motivation like nothing else because now you're making money, now you're a little bit older, now you have a job, and it's like your time commitments and prioritization are tested on a whole different level. Um, and so that was like another thing. I was like, okay, I just got to get through this. But um, one of the things I learned is like uh if you want it, it'll just come so much more naturally because when you're going into a master's program, if you didn't realize in your bachelor's or your undergrad of what you were interested in, by the time you're going to invest in your master's, you know what you're passionate about. So it's like you're a little bit more invested in writing and getting your point across and having the conversations about something that you're so interested and passionate in. And I really like this the style of like master's programs where they're a lot more focused on what you're um the school system is no longer trying to give you this like broad experience of you might like this or you might like that. When you get into a master's program, it is really to master on a skill that you're investing in, and that's really what I felt at the end of my public health program.
That makes sense. And yeah, it definitely is different from a bachelor's program when you're focusing on so many different things.
Yeah,
And you are able to get a little more niche down. Granted, you could still be decently broad in a master's of public health program, but you'll get more specialized expertise.
yeah.
And coming out of your master's program, was the first position that after you graduated the chief of outpatient clinic services at the Commonwealth Healthcare Corporation?
Yeah, actually, I was still in my quality management position. But the end of my master's program was interesting because it was during COVID.
Hmm.
And during COVID, I was the planning chief. And in our territory and in our governor, truthfully, like, and I admire him so much for doing it, but placed um, a lot of faith in our CEO, who is the health official for our territory. So it was like everyday training, and damn, if
Hmm.
that wasn't like, if God wasn't like, oh, you like public health, let me test how much you like it. Because it was community clinic linkaging every day with every partner, private, government, here, there, and it was just like that was happening at the end of my program. And so I was holding that role, which was so public health driven. And I actually, when things started to like dwindle down a little bit and I was going to go back to my regular job, um, I think I like kind of came to a point where I was like, I like what I'm doing, but I felt like I needed a little bit more. But I just didn't know how to go about it or what realm that would be in because I saw that like I was highly driven by public health, but there wasn't a position or space in public health for that to happen. And then I like took a step back. I was like, man, I think it's this like social people aspect. Like I still really like being involved in like helping strengthen things so that the service providers in the clinic can do their best job. But I also feel like I need to see more people because at that time I was running a team of 8. And I was like, I like seeing the community or I like hearing them and those kinds of things. And um, so yeah, then eventually I think it took like maybe after I officially got my degree, maybe like almost a year. Um, that the position for chief of outpatient clinics was handed to me and or like offered to me. I was really nervous because I was like, is this what is this what I'm looking for? Is this, and I was like, you know what, let's go. Like, let's just try. And it really, I felt, put a test to how hard, um, driving public health into the doors and into the mindset of, both providers and our community members was going to be. But thankfully, it was in a time of COVID where, truthfully, if you didn't understand how important public health was or what your relationship was to public health in your personal life or work life, COVID made that happen. Like, you knew like that there needed to be space for public health and health in general, in your everyday lifestyle. So, I was just fortunate that that happened when I got into this role. And it really did help expand where my thought process was, like, from public health into the realm of population health. So, yeah.
No, that's amazing. And shout out to you and thank you for all the work that you did during the COVID pandemic while also being a student. That's awesome. And I guess just on that point, like what was something that you learned from working during those times that you take into how you work or view the work today?
uh, I can't stress enough how valuable teamwork is. I really, everybody at that point was just trying to do the best they could do. And nobody likes going into a space like blindfolded. It was almost like everybody was like running towards what they thought that was solution, but they were like looking left and right to see, like, is somebody still running alongside me? Am I going on the right path? Like, but when you have a team behind you where you know whether you stand, fall, roll, however you're gonna move forward, there's people with you to support you. Like, it'll make things so much more meaningful, impactful, and like just driven. So that was definitely one of the things that I learned during COVID. Nobody can do it alone. It really does take a team, it takes a village. And truthfully, I think when in um public health, like school, is not always about instant gratification, right? Like, you can't see things immediately. Like, you come into the clinic, you're not feeling well, they prescribe you a medicine or they tell you to start doing something different. It's like you're just looking to feel better. But when you're doing things that public health preaches a lot about, it's like things that take time to like start to take effect or make you feel better or your lifestyle better. um so, that was really like important to me, on that.
Yeah, I appreciate you sharing that. And I could imagine just how important having a team and that teamwork was to the successes and overcoming many of the challenges that you all had throughout that time as well. And that's also awesome that you were doing this work and people saw that you were doing great work and they're like, hey, let's offer Halina this chief of outpatient clinic services position,
Yeah.
which I imagine you grew a lot into because you're currently the chief operating officer. So tell us about that progression and then what do you do in your role?
Yeah. I will say that it is something that I am definitely still, getting my footing with. Um, at the time, I had only been in the position for, chief of outpatient clinic services for 2 years. And what that covers is, like, like your typical public health clinics. But for the Northern Mariana Islands and for our health system, we have, what you would call like rural communities, but they're like two neighboring islands, and they have health centers on them. And those health centers have the clinics, the emergency rooms, and all of the public health and behavioral health programs. It's just combined into one health center. So that all fell under me. Um, and so I was still getting my footing and like really building onto the team because, for 6, 7 years of like where I was at work, I had a team that I could literally like, or not literally, but like almost wrap my arms around. So I felt so invested with like every individual that worked under. And so I also had more to give of every partner or person that I was coming into contact with because my team was so much smaller. And with it, like on it, like when that was offered to me, like, oh my gosh, like I now have all these people under me and learning the dynamics of how to move from management into being a chief, but staying connected and like trusting my team was something that I never struggled with, but um, learning and grooving into the difference of micromanaging and successfully guiding your team was something that I needed to take time and grace to learn. And I'm just so thankful that my clinic managers and my health center directors had patience with me and um, really helped me learn those ropes because they're so important. And I'm so thankful that all of that happened before I took on population health because it was like about a year around this time, a year ago, my boss calls me into the office and there are two other individuals in there with us who we all fell under our chief operating officer at the time. And she was like, well, we're gonna try something different. We're gonna do a pop health house, we're gonna do quality in business, and we're gonna do all facility ancillary support services. And so there was three of us, and she was like, and everybody's gonna be a chief operating officer for those houses. And I was like, okay, and she was like, well, Halina, you get population health, right? You have your master's in public health, you work so much with them, and which I was continuing to do because now I was in the clinics and I was the advocate. I was like, no, we need to be stronger with our public health programs, outreaches, and partnerships, and behavioral health links, and all of those things. So she was like, take it. And I was like, oh my God. Like, it really was like a dream just in a different way. Like, I always wanted to work in public health. I always wanted to be a part of the team, but um, now it was in my house and I was invested in all these other pockets. And if I didn't have those experiences or that 2 years grooving and moving with my clinics team, I don't think I would be where I am now with everybody that's in my pop health house, truthfully. Um, so yeah, it's really been a journey in the past year. Um, I will say like I have I said earlier, I try to be a simple person. I have never felt this amount of stress in my life. But it's like good stress. It's like stress of me thinking, are we doing enough? Are we doing it in the right movement? Does my team feel more supported? Do they need anything else? It's like those kinds of questions because I think what we never have the conversation with in health or just in leadership in general when you're growing in your career is like, how do you become a leader? There's not a master's level program that says you got your master's in leadership. Like, no, that's not really how this works. And so over time, there are things that you pick up as habits, build your skills, build you as a leader, but there are other also parts where you realize that, oh, I might have skipped that step or that's something that I'm still learning about and I'm still churning and grooving with. And so this past year has been a lot of that. I'm just so thankful. Again, it hones back into having just such an awesome team. Like they're so solid when I'm not sure and I ask them, I know they don't look at me like, Dan, you should know everything. Like I tell them that I am always going to be a student in life and especially in work because I look at them as subject matter experts and we can't all be experts on everything, but what we're good at, damn, we're going to be good at it. And it just makes us so much more solid.
Absolutely. And I think like you hit on a good point there that like management and leadership are not things that are inherently taught in school or inherently taught in in a career, but it is something that you have to learn as you are growing in those types of roles. um, and I know that you shared that you were able to learn that from some of your coworkers, but considering your journey from public health quality coordinator to chief of outpatient clinic services to operations officer for population health, what are some like advice that you would give to someone that is trying to come into an organization and really grow themselves or grow the impact in that work?
Don't stop being a student. Always invest in yourself and take up the space and also give yourself some grace. Nobody is perfect. Nobody's the perfect student. Nobody's the perfect teacher, but um, there will always be change, whether it is in your workplace or the environment that surrounds us. And so when you are also getting into this career, I think the first thing you need to ask yourself is, are you a people person? Are you a people person when you're going into public health or going into the healthcare space and even into population health? And it doesn't mean you have to be sociable. But when I say, are you a people person, is like, are you driven for what's better for the people, what your people need? That's so important in this career and in this space because that is truly who you are serving.
And what do you enjoy most about your role?
Um, Honestly, I really enjoy I enjoy being part of the community and like serving my community. Not every comment is the best comment, but that's life, you know. You take it constructive criticism and you build from there, you be better or you support your team better. I think um this space has allowed me to grow not just as a professional but as a person. And so knowing that um has really brought a lot of joy into this position and just also in general to my career. I don't know if you asked me when I walked out of high school, like, would you work in public health? Um, I don't know if that's what I would have initially said, but I'm so glad that I'm in this space and I truly enjoy it and being able to know that, like, even if it's not the best, we're taking like an inch forward for our community and really having impact to, I don't want to say change the way our people live because there's not anything bad with the way our people live, but it's making the impact so that things are sustainable and there is still and that there's a healthier future.
Absolutely. And also want to acknowledge you saying that you're taking good stress, and just wanted to like say thank you for taking on that burden of that work. And it definitely is worth it. So appreciate you doing that.
Thank you.
And I think a little bit earlier in your career, you were a fellow with ASTHO and the Satcher Health Leadership Institute,
Yeah.
uh, as well as you were American Hospital Association Next Generation Leaders Fellow. So tell us about those opportunities, maybe a little bit about them, and then what you learned from them, what you get from those experiences.
Yeah. So Ashley has actually been like one of these partners that along my journey through public health, like I was having like interactions with like I had a project here and there. They helped support a lot of our accreditation initiatives or performance management. So I think I had just got into the role for outpatient clinics, chief of outpatient clinics. And my boss sends me an email and she's like, hey, there's this leadership program with ASTHO. I want you to take a stab at it. What do you think? Um, and I was like, okay. And she's like, no, I want you to like be invested. And I think it's like a good space. You just got your master's in public health. This can only help you, like, form and groove into, like, I was going from a manager into a chief. Like, this was her olive branch to be like, hey, like, this is the investment that I'd like to support you with. So I did. And honestly, like, the Delve, like, program just totally, um, opened my eyes, ears, and mouth to what space is not just mine, but for my people, for my territory. I think culturally, it is not something that we're always the person that's like, oh, where's my seat? Like, how come I'm sitting back here? Or, like, we'll just wait our turn. And if our turn doesn't come, maybe we'll say something about it later, but it's not a big deal. But going into Delph, like, it made me realize, like, no, it is a big deal. You are a deal. You do make a difference. Like, if you are too shy to do it for yourself, you need to think about everybody that's right behind you in line, waiting to make another step forward right after you. Like, what example are you setting for them? And it did also, Delph gave me a lot of the tools I needed to take ownership of the type of leader that I was, the type of leader that my leadership believed me to be. And I was doing, but it just kind of made me feel uncomfortable to say, honestly, like, saying you're a leader is like not in my everyday vocabulary. So Delph eased that um into my vocabulary, but I think even into my headspace, and allowed me the thought process to own it and perform better for my team, to lead my team better. Because like, it just, I don't know if it's culturally or just the way we're raised, like, but I don't need any fancy titles, or I don't need for somebody to be like, oh, you're an awesome leader or this or that. But um what is also with us culturally, or the way that we move, is like, you got to get it done. You do it for everybody, including yourself. And that's why, I mentioned earlier about, are you a people person? That's what it is. And so Delph really gave me the tools and strength and confidence to take that space. So that's an experience that I will always hold dear to my heart and really truly appreciate. Um, one of the, like, funny small stories that I'll say about Delph is, like, I think the first time we met up, number one, it's like an opportunity to, like, be in a room and space of public health leaders that are not your coworkers. So it's like, you're just hearing the real rawness of, like, how everybody's health system works across the nation in different aspects and different roles. So it's just, like, very refreshing to know that you're on the right path, or also get inspired to be different, to move different, and the endless possibilities there are. But there's, like, one day of professional development that Delph does, and they did, I think it was like, they did headshots. And so that's not something that we do where in my health system. And I couldn't comprehend, like, why would you need that? Like, why, like, those different things. And it's just, again, like, a step of investment in yourself, right? And so that's really what Delph really brought wholesome to my plate as an experience. And so about a year later, my boss says, hey, like, I've had some interactions too with American Hospital Association, from my quantity days. And she's like, they got a next generation. And I'm like, where is this going? And I was like, she's like, I think this would be, um, helpful for you to continue to move forward. Because even though you have those strengths with, like, being a leader in public health, you are still holding the house for clinical. And, like, even though the AHA stands for American Hospital Association, like, a lot of their initiatives are driven by public health and community health and population health and all of those things. And so she's like, I want you to apply. I'm like, are you sure me? And she was like, yeah, I think it'll be a great opportunity and we'll never know if we don't try. Cause I was like, boss, there's not and we don't have anybody. And she was like, yeah, just like Delph. So be the first to try. And I was like, okay, here we go. And I got in and funny connection with like what you asked earlier, we had to get a scholarship because unlike Delph, this wasn't funded. My boss was like, apply for the scholarship by all means, please, and so you had to do a project around age-friendly health systems. And even if you didn't, if your hospital or health system wasn't an age-friendly health system, you had to have a project. So I used a community linkage project and I got funded and I got the scholarship. And the American Hospital Association Fellowship was um, structured in a sense of there were evolving topics that I think in the healthcare world are coming up, and you need a lot of education on to make sound decisions for your health system. And so that's the difference I will say between the two. Delph was really the investment in the individual, and AHA was the investment in the individual to make decisions and strengthen the health system overall, if that makes sense.
Yeah, absolutely makes sense. And I would say, like, shout out to your leadership because they definitely believe in investing in their people. And I think that that's awesome to see.
Yeah, I will say that makes makes the stress and a lot of those things a lot easier. Is because like even when it's hard, when you know that your leadership supports you, believes in you, or will guide you into a space if the space that you're moving in isn't working, like for those kinds of conversations to be able to like move fluidly, makes so much of a difference in your workplace. And so I am so appreciative of the opportunities that they have allowed me to participate in and also encouraged me to do.
And before we move on to the Furious Five section of the conversation here today, I would love to ask, where would you like to see yourself in the future?
Um, I would like to still see myself working in my health system. Um, I just want to continue to serve my people and be part of like the future and innovation of programs and services to come. Uh, I mean, where I was 10 years ago and the things that existed in our health system from the hospital to the clinics to public health to behavioral health, and where we are now and where I'm sitting, like, I can't believe the changes. And we have a lot of stuff that is planned for the future. And like, I'm so excited. I'm so excited to be a part of the dream and hopefully continue to be a part of the building and the implementation and the living and breathing of just such a strong health system for a strong community.
Love that. And look forward to seeing all the great things that you're able to do. And also want to lift up that you said that you have to take opportunities to light that path for the people behind you. And I think you're doing a really good job of that. So continue
Thank
to
you.
shine. You're most welcome, Halina. So moving on to the Furious Five, the 5 questions that I ask all guests. Number
Okay.
one, what advice would you give to a student trying to pursue a career in public health?
Like I mentioned earlier, are you a people person? Not sociable, but are you people? Will you serve your serve your people even at the times where you feel like you might be part of a challenge? Will you always put your people's interest at best and move in that direction? And also never stop being a student.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Keep learning, even when you think the conversation or that meeting that they assigned you to has absolutely nothing to do with you or where you're at in life or where you're at in your career, show up, listen, get a little bit, learn a little bit. It'll come full circle. I That's the experience that I've had, and um, don't limit yourself to what you think or a textbook or a course or a program may say public health is. Public health is everywhere, and give yourself the opportunity to be a little bit knowledgeable in every space because it'll only help you to serve at your full potential in this position.
Number 3, what's something you're working on improving in your life right now?
Um, Finding my footing with all my staff, I think. I am a people person, but I'm also, I said earlier, you don't have to be a sociable person to pursue a career in public health, but I am truly sociable in my life, I like to say. And so I really do like having an investment with all of my staff, and truly with the amount of staff that I have now, um, I'm just trying to find my groove on what is like a meaningful investment. I take pride in knowing names and faces, and but I also, have to realize like not everybody likes it when they see their boss and their boss like, hey, good morning, like what's up, and tries to have a conversation. Like that's just not how they are. But how to be in the space where, okay, then let me make sure that they feel supported and heard. And if they need anything, that I'm here without overwhelming them. I'm still trying to find my footing and groove with that. So yeah.
Number 4, professionally, do you recommend anything?
Um, on the contrary, I don't have a particular book or you should listen to this podcast, but I was just having a conversation the other day with um a colleague of mine who I actually met through Delph, and I was just saying, I recommend taking time to be this sounds this maybe you have to edit this out, but just allow yourself to like be nonsense. Just to not be able to give yourself space to enjoy something that relates absolutely to nothing in your professional life. Whether it's binge watching a show or reading a book, that just giving yourself that space, because you need room to breathe and catch your breath so that like when you get back into the space or you get back into your office, like you're delivering because you had space to take that. It's not just about taking a mental health day when you need. It's about giving yourself that space in your life and not being so consumed on just your career or what's driving you there, but also like what makes you laugh, what makes you happy. And sometimes those things are not tied to your career or your job.
Absolutely agree with that. And then last but not least, if there was one piece of advice you'd give to your younger self, what would that be?
You're doing good. You're going to be good. It's like everybody's, what you think everybody's expectations are for you are just supports for what they want you to be in life, which is great.
Halina, thank you so much for coming on and sharing your story. I thoroughly enjoyed hearing more about it and getting to learn a little bit about yourself.
Yeah, thank you so much, Amari, for having me. And shout out to Harold, who I met through Delph, for connecting us and like opening up my eyes to your podcast and this opportunity. I really do appreciate it.
It truly, truly is my pleasure. And thank you for all the work that you are doing. So, housekeeping items, everyone. Thank you so much for listening or watching this. If you made it this far, be sure to hit that subscribe button, leave a 5-star review if you listen to this on a podcast platform, and share this with a friend who gets some value from it. Greatly, greatly appreciate you all. Peace and see you all next week.
Adios.